Hey everyone, Josh with Ultralife today. If you like what we're doing, like, subscribe, and share. Hey everyone, Josh Bellieu with Ultralife today, visiting with our guest and friend, Mary Jane Frye. If you like what we're doing, like, subscribe, and share. And Mary Jane, it's always a blast to have you in here. You're a doctor of pharmacy, so pharmaceutical drugs, compounded medications, corporate pharmacies, independent pharmacies. Your background is how many years now in this?
44
years. So what is the difference between somebody coming in and just picking up a pill prescription versus a compounding pharmacy, which you happen to be a part of one, and actually what they do and why that's different and why it can actually be better, or is pros, cons?
So we are an independent pharmacy with a compounding service.
Okay.
So we take care of all regular prescriptions, and then we also utilize the compounding pharmacy business for animals, for hormone products, for dermatological products, all different places that people need sourced. So even chemical, not having as many chemicals in the product. So we can have a lactose-free product. We can have a dye-free product.
Nice.
So those are benefits for people who have high allergies or reactions to certain chemicals. We can help them. We also, as an independent pharmacy, we're owned by a man who has had the pharmacy for years now, and he is involved in the day-to-day business. And so with that, he knows the patients, he does some of the compounding, he works the counter some, and then he runs the business side of it also. So he has a personal connection to the business in comparison to a chain pharmacy where the pharmacists are trained the same as we are. We all go through the same pharmacy school training, but their bosses are not on site having the support, knowing the patients, calling the patients by names for the last 30 years.
Right.
That's one of the differences. We also have a large pharmaceutical-grade supplement business, which means that the supplements are tested and are held to a higher level than a lot of the supplements. They're not the Amazon type realm of supplements
Right.
in terms of walking in the pharmacy, getting them off the shelf. But then I've specialized in that side of the business for years now,
Right.
and have kept learning. And so people can come in and ask me questions about supplements, and I can support them in the pharmacy itself, or we can make consults and go over a whole category or a whole problem that they might be having. Or even in the realm of basic pharmacy, I'll do drug nutrient depletion consults, or just we used to call them brown bag reviews, where you brought in your medicine and we went through and double checked how you were taking them, what you were taking them with or not with, what foods and no foods dependent. So even to the basicness of that, we take more time. And have the ability to take more time than the chain pharmacists. And then we're also an immunizing pharmacy now. So people can have their flu shots or their pneumonia vaccines or their shingle vaccines at the pharmacy. Most doctors' offices do not give vaccines anymore because the insurance system has figured out to utilize the pharmacies in that way. When we give immunizations, we have more than one pharmacist on duty typically, and so somebody's not getting pulled off of the counter to give an immunization. And sometimes we'll even have clinics where we have them set up to where they come in, at a specific time. So we're all double covered. The poor pharmacists at the chain pharmacies are getting run ragged, and a lot of them are being pulled off of the counter and filling a prescription to go give a shot and then going back. The chain news is coming out on a regular basis of more chain pharmacies being closed in different parts of the country. Nationally with the chains, but actually the independents also. If you don't have a niche, then you're shutting down because of the insurance situations. So that's really hard for the chain pharmacists.
I heard someone discussing the different education in the drug world, pharmaceutical drug world specifically, years ago. This had to have been 20, 25 years ago. And I was shocked that doctors basically have almost no hours of education on drugs, and yet they're dispensing them, writing prescriptions all day long. And that's where I feel like you come in, and especially the way you describe the culture there at Medic Pharmacy. You'll do these things where you walk people through every drug they're taking. The interactions. You know when they should take them, when they shouldn't take them with food or anything. And I suspect, and this leads into my next question, and that is this. Are there interactions between supplements and drugs?
Oh, there actually absolutely can be.
Okay.
So
how does one learn about those? Because I suspect a lot of pharmacists don't know those, or do they?
Probably not,
Okay.
a lot of them. So what you have to worry about in any medication is if it's blood thinner or not. So a lot of the anti-inflammatory natural substances can have blood thinning effects. So if somebody is pre-oping for a surgery and they get told that they need to be off of their medications that have blood thinning effects for so many days,
Right.
then a lot of times they'll call and say, well, they told me I had to be off of all my supplements. And I'm like, well, what did they say? And we'll talk through vitamin D or, certain medications that they could still stay on. But there are definitely interactions in that space, or just what medications they're taking and their timing of when they take them. So if somebody's taking a blood thinner on a regular basis, what can they take and not take? And a lot of times I'll say, please ask your physician, if you can take this supplement to confirm. Because I don't want to be the person that the physician rolls their eyes and says, oh, that pharmacist, is giving you all hogwash and you need to not. I try to be very research-based and recommend things that can support. Sometimes the patient doesn't want to take a medication, so it might be an alternative to a medication if they choose not to take a medication. But I try not to be antagonistic to the
Right.
physicians. The physicians, it's not their fault that they had an hour of pharmacology.
Yep.
But they're trying. I've heard that there's some changes in some of the med schools where they're actually learning about supplements. And so that's a good thing.
It is indeed.
Learning about gut health instead of just a colonoscopy.
Right.
People will say to me all the time, the colonoscopy didn't show anything up, but it hurts still. And I had one GI doc who actually would send patients to me, and he would say, go check with Mary Jane about probiotics. Well, I didn't like that terminology
Right.
exactly, because sometimes it was more about histamine or
Yep.
something else going on. But I don't fault them, for their knowledge base at the pharmacy level. Where I fault some things is if they don't recommend the pharmacist talk to the patient, and just the generalness of get your drug from your mail order pharmacy.
All right.
So that they end up with no discussion with a pharmacist. They don't know their pharmacist. I had some of my patients I've known for 30, 40 years, and they'll, talk about me as their pharmacist, and the friends will say, "Your pharmacist?" Like they don't know their pharmacist's name.
Right.
And so those relationships that are built are huge for them coming back later and asking
Absolutely.
us to help them with other problems that turn.
A great resource that I have found for looking at drug interactions, it surprised me when I started getting on PubMed years ago that there were not 1,000, 2,000, 3,000, millions of research articles on, believe it or not, supplements, on botanicals, on herbs, on all these different things out there. And I will often say to people, I'll say, well, can I take, UltraCurt with this or that or anything? Well, we're not allowed to give that kind of medical advice, so I may send them to you or another health practitioner that I know. But I'll tell them, say, go to pubmed.gov and type in your drug and that particular supplement, that fish oil or whatever it is, and then do a little research yourself. I find those abstracts popping up can be absolutely fascinating and so helpful. And I've learned I didn't realize that there are, 25 or 30 at least things in nature that we tell people to take every day that all thin the blood. Mm-hmm. Ginger thins the blood. Fish oils thin the blood. Curcumin thins the blood. Yes, yeah. Garlic. It just goes on and on and on down that list. So
I would say that
yeah, and I wanted to ask you, is that a good place to go or not?
The run-of-the-mill person doesn't go to PubMed.
Right.
And PubMed can be confusing for people. So most of the time it's just Dr. Google. And you're going to have lots of different opinions that come up on Dr. Google. So I would probably preface it with saying, or asking them, do you have a pharmacist you trust? Right. Why don't you talk to your pharmacist about that? And let them work within their own pharmacist relationship to build that.
Good answer.
Instead of just going straight to PubMed or Google Doc.
So you're a doctor of pharmacy that has this amazing knowledge in the health arena, natural health arena, and learning more all the time, and yet you are there at your pharmacy, and so many people are relying on medications. How have you helped to gently educate people? Because I know in this particular world, I tell people all the time on our podcast, I say, do not be angry at your MD or your doctor out there, because when they went to school, what they were taught is what they were taught. Mm-hmm. And it doesn't enter into the Mary Jane Frye paradigm of supplementation and genetic testing and all these other tests that you do and bioidentical hormone replacement. So how do you reconcile that on a daily basis in your practice? I mean, you're a very sweet person, and yet you're also very forthright and very educated. But do you find yourself trying to shift people gently around in the pharmacy when you see that maybe they're doing things that are really maybe hurting them through the pharma world? I mean, this is a very touchy question for me to ask. So I'm dancing around it.
No, it's okay. So the one place that I do a lot of support in between the pharmaceutical and the supplements is the whole proton pump inhibitors, the Prilosec, the Prevaceds, that whole world. So when that medication was approved, it was approved for 10, 12 weeks, heal an ulcer.
Yep.
Then they started treating reflux with it. And patients have been on the medication for 20, 30, 40 years sometimes now. That's too long on that medication unless you have a specific diagnosis where your body produces so much acid that you have to shut that acid down. Unfortunately, you can have reflux with too low of stomach acid.
Oh,
and
absolutely.
I think we've talked about this before.
Yes, we have.
So I try to get people to shift their thinking and explain that the too low is just as dangerous as the too high, and all of the different issues that can go on in their body when it's too low.
It's
And
sure.
so that's one of my big places that I try to deprescribe, is the term in Canada
Wow.
for getting patients off of medications. And we don't really have that term in the U.S. yet, but I try to utilize that and get patients. There are some doctors who now will do that. The Afrin, scenario that
Oh,
we
yeah.
talked about. That's probably one of those places where they've deprescribed or tried to get patients off of Afrin for a long time because they know that rebounding effect.
Right.
But in the gut, it's a mucous membrane, the same as the sinuses are. And if you're giving something that's changing the microbiome of the gut and changing the absorption of nutrients, changing the digestion of foods, then it should be deprescribed whenever possible.
Yeah.
And so that's one of my passions.
I'm sure you do like I do, but whenever I'm sharing a particular thought with someone about maybe a supplement to take, what's really neat though is when they have a little result with something that you've given them, all of a sudden they become kind of a little bit of an open book, don't they? They open up and they're
Oh,
like,
yeah.
what else can you tell me about Mary Jane?
That happened.
And it's cool.
That happened last week. A woman had come in and she wanted to sleep better. And so I gave her one supplement to sleep better. And she came back last week and she said, okay.
What else do I need?
Yeah. She said, you've helped me sleep. Now let's talk about what else I'm taking and how you would do it differently.
Brilliant.
So those little interactions downstairs, because the consult room is upstairs, and I'm not always downstairs, but every time one of those interactions comes into play, then it makes me know why I still have downstairs time.
Yeah,
Because
indeed.
I can't interact and work with patients if I'm constantly upstairs.
Yeah, you're awesome, and you're so personal in your approach, and I'm so glad that you're still around Oklahoma City changing lives. We love having you on, as always. This has been Ultra Life Today. If you like what we are doing here, like, subscribe, share. You can learn more about our company at ultratoday.com. I'm Josh Bellieu. See you soon. I felt so off today.
You were fine.